information. And so the next question I want to ask us to discuss about is I know so many people have different experiences during COVID-19 pandemic that is still very much on. And we had the spike on the case recently in our area. So I'd like to really ask you guys, beginning with Elise, what was your experience during COVID-19 pandemic? And what was it like for you, Elise?
So as a manager, I was running an outpatient program, and we closed our program down to protect all the outpatients not to come into the hospital. But I needed to readjust my role because I needed to jump in. And as a trained respiratory therapist who's worked in ICUs for 25 years, I thought my best opportunity was to go into the ICU and help run arterial blood gas samples to help the staff understand how the patients were breathing and how we can help them on life support. The experience was a little shocking, but nonetheless humbling.
Thank you for that. Gabby, tell us more about your experience during COVID-19 pandemic.
So I primarily worked on 3 South during the pandemic. I was deployed a few other places at times, but for the most part, I was on 3 South, which was actually a makeshift ICU at the time. It was kind of the overflow for the ICU. It was pretty chaotic every day. As we know, in the pods of the ICU, the doors can be closed and they're glass, so you can see the vented patients through the doors. However, on 3 South, we had to keep the doors open at all times. So that meant the N95 did not come off unless you went through the double doors or the bathroom or the break room. Staffing was always an issue, obviously, and people like Elise, who had ICU experience, were, you know, a huge help. But as a nursing assistant, my role pretty much was just getting vitals every hour, because the vitals machines that we used weren't like the ones in the ICU. They didn't go straight to the computer. So we wrote them down on a piece of paper outside of the patient's room, and I washed a lot of hair and faces and talked to them constantly. I got rectal temps every 4 hours for the nurses. I was pretty hands-on most of the time.
Well, that's good. So Irene, tell us more about your experience during that time frame and that time period.
Okay, so I guess to be able to discuss my experience specifically, I would have to talk a little bit more about palliative care and what that involves. For us, we work with a lot of patients with chronic illness, you know, end of life issues, end of life care, certainly deal a lot with goals of care, what's important to patients, depending on where they are in their illness and in their prognosis. So the experience for me was certainly a trying one, because it changed a lot about how I felt about my job. It changed for me the connection that I could have with the patients, because with palliative care, we really work with having the families and the patients all be on board with what, again, their goals are at the time in their lives when it's difficult, because they're making decisions regarding advanced directives, how they want to move forward with regards to treatment. And with, you know, this experience with COVID-19, really the families and patients could not be together. And therefore, and lots of these patients that we saw were at end of life, which at a time like that, the most important thing is, of course, for family to be present, for there to be a closure, and for the family to be able to, you know, sit with their loved ones, tell them they love them, tell them what they need to tell them, so they know that it can be a peaceful transition. And a lot of that was missing.
Thank you so much for sharing that with us. And Belinda, you work in the ED during that time. Am I right about that?
Yes.
Can you tell us your experience about working in the ED during the pandemic?
So I don't even know where to start. So the ED, as I was explaining to you, Andrew, the other day, it's the entryway to the hospital. So we didn't know what patients were coming into the hospital at any given moment. We didn't know if they had the virus, whether they were a patient under investigation, or we knew that they had the virus. We had no idea. So when people came in, we were scared. Every single one of us, we were scared. We didn't know what to expect. We had to create alternate triage areas. We had a COVID tent outside. that most of you probably have seen for the patients that we thought may have been infected with the virus. We had different areas, negative pressure rooms, where there would be sometimes 5 patients at one time in those glass rooms. And if you get that assignment, you're stuck in those rooms for a majority of the night with those 5 patients. So that's a large viral load that you're being exposed to. So it was very emotionally, physically draining. Things were changing every single day, every single shift that I came in. We had different protocols, different rules to follow, just because the virus was evolving in different ways. So it was scary. It was scary in the ER.
And those experiences must really be very, very challenging for each and every one of us, because for me, I was redeployed to BHU, and I had to work with those guys who, in addition to this, were going through some kind of mental health issues, and then had to support them in that regard as a psych tech and provide what they need for them, kind of help calm down their own anxieties. And that was my experience working on BHU. And these experiences were very, very challenging in their own right. So of all these experiences you've had during that time, what was most challenging for you? And I want to begin with Gabby to tell us about what was most challenging for you.
In the beginning, I think for all of us, it was the unknown. We started to get PUIs, and on the floors, it was, you have 2 negative pressure rooms. So you had 2 rooms that those PUIs, the patients under investigation, could be in. So there was so many questions. The changing of the doning and the doffing of the PPE, of, which PPE do we use? What kind of garbage bag do we use? What do we do with the food trays? What do we do with the dirty linen? There were so many questions. And like Belinda said, the virus was evolving hourly. The policies were changing so quickly. So working on the floors and having those patients come in, and like she said, you didn't know, the results would be so long to come back, and it was scary. And it was even more scary to know that you had to tell these patients, listen, you can't have a visitor now. They're scared. They didn't know what was going on, So it was, I think the hardest part for me was, I was scared for myself and my family and my coworkers, but I was more scared for those patients. They were in these rooms, people didn't want to go in there. And when they did, they were in this garb that was foreign to them, So I think that seeing that was the most difficult and challenging for me.
Well, thank you so much for sharing that. Irene, I know we spoke about your experience, especially for the end of life experiences for the patient themselves and then their families. Of all those experiences you had working with them, what was most challenging for you?
The most challenging for me, Andrew, was through COVID, the only access that family members had to patients, especially COVID patients, actually all patients really, while COVID was rampant as it was, because again, the restrictions were, there was nobody getting in, which was bad on all levels, but it was worse certainly for patients with chronic disease, and again, end of life, where they have weeks, possibly days to live, and not for palliative care, where we are so involved, again, getting the family together, making sure that they have a good experience at that time, that they can go home and say, I did the best that I could. I got to say what I needed to say. It's important for me to, really make that happen. So, and again, through COVID, there was no visitors coming in. So I was certainly one of the many providers, and again, with the nurses and nursing assistants as well, they depended on all of us, families did, to let them know how their loved ones were doing, how their brother, sister, mother, father, husband, wife, we were their go-to. And the hardest thing for me was to be on the phone every day. And again, especially at end of life, because they're hoping for the best. They're trying to prepare for the worst, but they're hoping for the best. And never, so many times, not to be able to give them that good information because they weren't doing as well as we'd hoped. And then again, not to be able to allow for that closure to happen, where the families were not able to get in to say goodbye. That was so challenging for me, and certainly challenging for the families, of course, of these patients that often died alone with no one at their bedside.
Well, thank you so much for that. And the ED is a gateway to the hospital. And Belinda, you worked in the ED. Tell us about what was most challenging for you during that time.
So it was definitely, as Gabrielle and I were both in the mix with the patient care at the bedside. The most challenging part for me, it was the emotional aspect of it, because you see these patients, they come in, they're struggling with the virus. And these patients, they were struggling. They come in, they can't breathe, and they go downhill so quickly. It starts as shortness of breath. Then within minutes in the ED, we're intubating patients, and we're trying to get consent for these patients, and they're not even understanding really what's going on. So once you're intubated, you can't talk, you can't communicate, you're under sedation. And we're trying to explain this as best as possible to these patients at such a scary time, and they really don't know what's going on. So seeing all of this and seeing the emotion from the patients, from my colleagues, we're all scared. We know that this patient might not come off the ventilator once they are intubated. So that was probably the most challenging for me. Physically, it was all the PPE that we had to wear. We had to wear the N95, a surgical mask on top, changing gowns, the face shields, the hair nets for 13 hours on end. And from the lack of oxygen from those double masks, you just felt so dizzy, you felt so sick, but you had no choice because you needed to protect yourself.
Wow, that is tough.
Mm-hmm.
Oh, Elise, my friend, tell us what was most challenging for you?
I think the most challenging for me is that, well, when I first walked into the ICU, I was stunned at what I saw. IV poles outside the rooms and ventilators outside the rooms. The guts of the ventilator was in the room and the control panel was outside the room, and nobody really in these rooms. So as Gabrielle said, in the ICU, they're all glass, so you can see the patients behind there, but in some of the other rooms, there's no glass. And so everything's just outside the room. And I've been doing this for a very long time, and I've been through, in the 80s, the AIDS epidemic, the HIV epidemic, and it was very shocking and scary for me. This was far worse. So once I got over that, I was working from 3 a.m. to 11 a.m. because that's when most of the blood draws had to be done and most of the numbers had to be given. But what's shocking and challenging for me is as fast as the news would give us about how to treat these patients, the modalities change. So we have a ton of technology, and respiratory therapists run the life support and the oxygen, and we do all that. And we were focused on doing it this way because this is the way we thought this disease was going. And next thing you know, nope, we have to do it this way. So at first it was quick, get them intubated and protect them. And then later on it was no, try to prone them and keep them off the ventilator. And so while I wasn't working, I was reading as much as I could to understand the diseases and its components and how to apply the technology in the right way that wasn't going to cause more harm, but do good. Also, when I would run the blood, and you probably heard this in the news, if I walked 10 feet from the patient's room with the blood to the machine, the blood was clotting. Results were being clotted. Now I had to troubleshoot these machines and unclot them. And the results were staggering. Numbers that I hadn't seen ever before of people so ill, and just wondering, how are we ever going to turn this person around? And then while you're doing that, overhead, it's code after code after code, and just running to the next fire. It was so surreal how many patients in the short period of time needed to be intubated. You ran from one to the next, to the next, to the next, and then assuring that we had enough equipment. We have a fantastic administrator who made sure we had everything we needed, but we had to pull equipment out of that was out of service and get it using, getting it able to be used, which required finding old pieces to attach to it and finding a ventilator hose that didn't go with this machine that went to this machine. So it was constantly being on and trying to think of the next step, where this virus was going to go and how it was changing so rapidly and how we as a medical community were going to respond so that we didn't cause harm, but that we helped.
Wow, that was a lot for me to even understand what you did. Huh. So when you look back into all of these experiences you've had in the past during that time frame, what would you have done very differently? What difference would you have brought into your care for patients, and how would you have attended to them, given what you went through, knowing what you knew at the time? Now looking back, what would you have done differently, Irene?
For me, probably letting the families much earlier than I probably did know that despite the course of the patient and what they had ahead, that no matter how bad things got, I probably would not be able to change, I would not be able to change the ultimate outcome of being able to get them in to see their loved ones, to be at the bedside with them. Because I think after a while, you sort of have a connection, because again, you're their go-to person, and it's the same for the nursing staff, the nursing assistants, all the providers. The families know that we're the only ones there. They look to us to get some support, and on a daily basis, talking to them to try to inform them what to expect as the disease progressed. Sometimes it was good news. Unfortunately, more times, as Belinda spoke to, it wasn't. And I think sort of to really, you're always hoping for the best. You're planning for the worst, you're hoping for the best, you're hoping for always being able to give the best news that you can. But ultimately, a lot of the time during those last months when the pandemic was rampant, unfortunately, the news was not good. And I think for me, I probably should have really initiated that conversation first day with them, with the families, letting them know that, things are not going to change. When this patient is COVID, you are not going to be able to be here with them. But again, when you're attempting to have a connection and explain a very difficult situation at a very difficult point in their lives, you don't want to sort of start with that conversation either, because you have to get that connection. So, but that is something that but now people, really understand that. Certainly at the end, when things were starting to get better, I felt like patients' families understood that this was to protect them and protect their families, and were much more amenable to, understanding what this meant to try to be safe on the outside world.
Well, thank you so much for sharing that with us. And Belinda, you work in the ED, and I'm sure the ED is always like a roller coaster kind of experience for you. But when you now take a step back to look into what you did at the time you provided those cares for those people, what different mode of care would you have provided now, looking back?
So I think we did our best to handle the evolving virus very well in the ED. My manager, supervisor, we all worked well to establish the best policies. But again, the only thing that I would personally change is exactly what Irene was saying. I feel like we didn't let the families in. It was to protect them, but at the same time, the follow-up call that they did get was not a good one. It was the first call to the family members was to tell them that their family member was no longer with us. And hearing the emotional toll, being on the phone, hearing the doctors make those phone calls, it was just hearing the heart-wrenching cries and screams, even through the phone, that it was too emotional. And then again, I don't think we really could have changed anything, because sometimes this stuff just happened so quickly, especially in the ER when people got there too late, and not when they first had the symptoms. They got there when they really couldn't breathe already. So they would deteriorate very quickly, and we didn't even have the time.
And the other thing about that is the fact that your primary concern at that time is to save them.
Exactly.
So you would do anything and everything within your powers to keep them alive and get them back into where you want them to be at least to stabilize them. So, I mean, I totally get it. And so, Irene, at least tell us about if anything at all would you have done differently looking back?
I mean, I don't really think there was a lot to be done differently because everything was so new and forthcoming at every moment. So I would say in the beginning, maybe I was a little fearful. And so because I was afraid that my mask seal was going to break, or maybe I didn't speak to them as much as I normally did. So when I'm with a patient in the ICU, I would talk to my patient all the time. It's, you know, obviously it's a one-way conversation, but I have this conversation and I tell them what I'm doing, what I'm thinking, whatever, to keep them engaged and to know that they're listening. But I think I was a little fearful that as I talked and moved, that the seal of the mask was going to break and I was going to put myself at risk, bring it home to my family and put them at risk. And I think I was a little fearful of that. I also had COVID in January.
Oh, boy.
So I knew how sick I was. And so I was really afraid to give it to everyone else. I have a dad who's immunocompromised. And, you know, so I think that if I could change that, maybe I would talk even more to the patients.
Yeah. Yeah, especially when you work in a very, very, very tense environment, it's always very hard to remember what you should have done differently at the time. But always a good thing is to always take stock to really think through things and then look at what I need to do, how I need to change things moving forward to improve, get things we're going over and above to provide excellent care to our patients. And Gabby, I know you work on the unit a few times and then maybe back and forth on in the ER. So what, if any, would you have done differently?
I'm gonna be honest. I don't think that I would do a single thing different. It was so difficult to get the equipment that we needed. I mean, from ventilators to vitals machines to an N95, bags to put our equipment in. I could not be prouder to tell somebody that I was part of the team that I was part of. And my team was different every day. I had people that I've never even seen before. And I worked with these nurses and these doctors so closely. And the fact that we all came together the way we did with what we had, I look back now and I don't think anything could have changed. We really did our best. And like you said, Andrew, our main priority is to save lives, is to make people comfortable, is to, you know, provide that care that, you know, they deserve. And I think that we did our best with what we had.
Wow. Thank you everyone for sharing these experiences with us. I want to turn the picture on yourselves now. Every day you go home from work, or every time you think about work, some kind of anxieties come on you. Something is well up in your mind. Fears, uncertainties, what's going to happen to my family? How am I going to take care of myself? I don't want to get sick. I don't want anything to happen to me, to my family. But then something has to be done. So during those times and even beyond those moments, or even as a matter of routine for life, what did you guys do to take care of yourself? Because there is always this saying that you can't give what you don't have. You can only take care of people if you're well yourself. What was it like for you taking care of yourself? What was your own self-care strategies, plans, routines, program of event that you do to take care of yourself? So tell us, Elise, let's begin with you.
So first and absolutely foremost is sleep. I could not have done this if I didn't baby myself and get sleep. I had to wake up at 1:30 in the morning to be at work for 3 a.m. I haven't done that on the night shift until I was, I don't know, 23 years old, which was many years ago. But that being said, sleep was very important to me. I had a lot of anxiety when this first started. And that anxiety was coming towards close to the end of my career. Maybe I should retire. Maybe I should quit. I don't want to do this. I'm in rehab. I work in outpatient. I don't want to do this anymore. And I got myself in a tiz. And I got so anxious. And really what I had to do was really focus on that I'm part of a team. I was trained for this. I did it for many years, and I can reach down deep and pull it out and do what I needed to do. But with that, my anxiety was very, very high. And I did a lot of, other than sleep, I did a lot of meditation. At night before I went to bed, I would do a guided meditation. I would just pick one on YouTube or on Spotify or Pandora. My mind was racing. What happened with these patients on the ventilator? Maybe we should have done it this way. What about this way? And my mind was going 100 miles an hour, trying to draw back on, my schooling and the technology and all that. So that, and then I actually did withdraw from some of my friends, but I had someone at work who was going through the same thing with me, and we actually connected. And it was a beautiful thing because I got to know therapists that I've never worked with before, and they were through the same thing as me, so I was able to speak to that. Additionally, my husband works in one of the very large hospitals in Manhattan, and so he was going through something very similar. But funny enough, we didn't talk a lot about it because it actually made us anxious to talk to each other about it, because I was worried about him and he was worried about me. He also did get COVID in April, so he was home short of breath, and I was trying to work and keep my mind clear. So I think sleep and meditation and really connecting with some of the therapists in the trench, you pulled it together like Gabby said, and the team was really very supportive.
That's very good. It's always good to have a team that works well together and that supports your work, because that is one big chunk of work taken off your shoulders. So Gabby, tell us, what was your self-care routine like each day, each week, or each month before COVID, during COVID, and even after COVID?
I'm going to be honest with you, Andrew. A lot of those few months are a blur, and I'm sure other people can kind of relate to that. I will say on my ride home from work every day, most of the time before COVID, I would jam out to my music. During COVID, I rode home in silence. When I got home, I did not watch TV at all. I distanced myself very much from social media. I didn't go on Facebook for months, which says a lot about our generation. And, kind of like what Elise said, I have a great family. My fiance is wonderful. My sisters are great, but I could not come home and talk about it. I could not talk about it at all. And I felt like when I was at work, me and my coworkers and my manager could vent about it, or, I can't believe we're reusing our N95s and things like that. But to talk to somebody who was outside of this was really impossible, because they just didn't understand. And it was hard for me to kind of change people's minds, it was impossible. So I felt like it was a battle within myself that I just did not talk about it. That was a huge self-care that I did. I just kind of shut down in a way, but I pride myself in also being able to come home from work on any given day and kind of shut off what happened at work. So that came in, that definitely came into play during this time as well. I was able to do that.
That's good. That's good. Thank you for that. And Irene, tell us about your self-care routine, plan, or strategy.
Well, I can absolutely reiterate what Elise and Gabby have said. And I'm sure all of the panelists feel the same way. You kind of have to step away, if possible, to be able to remain sane and come back and do it another day. For me, when I would leave work and I would get in my car, unlike Gabby, actually, I didn't want the silence. So I would listen to my Audible books or listen to music as a distraction, because otherwise I would be thinking everything over in my mind, thinking, you know, what was left behind, what we had to come back into the next day. And always, especially in the beginning, the unknown. And that was always sort of, you know, you're always thinking about that. So when I get home, I just like Gabby, I haven't watched TV to this day, honestly, since that started, because when I did in the beginning, truthfully, you know, you'd be hearing more numbers, you'd be hearing more awful news about how many more deaths, how many more awful things that were happening. And I felt, you know, we've seen enough at work, and I need to be not looking at that to be able to, again, come back the next day and do it all over again. So dinner with family was very important to me. Playing board games, you know, laughing at the silly things. And again, they would ask questions of me about it, because of course, you know, the public want to know what you see and what you hear. But for me, I'm like, please, I just couldn't do it. I couldn't discuss it any further. And not discussing it further actually made me, and I think Elise may have said this, you know, with my friends that would reach out to me, I think I became a little bit more introverted through those 4 or 5 months, not wanting to, you know, just getting comfortable being home and not needing to talk to, because when my friends would talk to me, of course they want to know how you're doing and how things are, and if the hospital's really as bad as people say it is. And I wanted to kind of leave that at work and not discuss it after I left work. And that's really what's helped me, honestly.
That's very good. So Belinda, tell us, ER, how was it like taking care of yourself after work? 12-hour shift.
I know. So for me, I did focus a lot on the physical aspect of taking care of myself. When I would get home, of course, what we did, I think all of us did, we made sure to take all our clothes off, make sure that everything is left at the door. You don't bring anything into the house, you throw it right into the wash, you jump right into the shower. That was number one. That was number one. Other than that, as Elise said, a lot of sleep, just taking care of your body. I did a lot of supplements. I take a lot of turmeric, elderberry, zinc, and emergency supplements, those little powder packets, as well as thieves oil, which is an essential oil that's very good for respiratory health. I would get into the habit of just inhaling that as I slept, and I feel like that really rejuvenated my system, made me feel healthier, especially respiratory wise, after working these long shifts. Emotionally, it was our colleagues, the people that were going through it with us, that helped us along the way. Like everyone else had said, we kind of shut down to everyone else who didn't know what was going on, who wouldn't be able to understand what we were going through. So the times at work, when there were plenty of times where there would be patient deaths, young patient deaths, which we're not used to seeing, and I would cry. I think one shift I cried for 45 minutes straight about a patient death that I saw, and I had all my colleagues there consoling me, making sure that I was okay. My manager said, you know what, take the time, you need it. So a lot of it, I have to be thankful towards my colleagues and all of them who helped get us, all of us, through this time.
Wow, that's deep. And looking back in all of this, what lessons have we learned? What lessons do we think these experiences have given us? Let me start with you, Gabby. What lessons have you learned?
I think that one of the most important lessons is that we're not invincible, you know, and, you know, taking care of ourselves is priority when it should be priority when you're taking care of somebody else. You know, it's, you know, everyone referred to healthcare workers as heroes, and we are, but we're not invincible either, you know. I think the second biggest lesson too is like I touched on the last answer, I could not change people's minds about what was actually happening. You know, there was, you know, the political aspect, the conspiracies and all of that, you know, which is why I also distanced myself from the news and Facebook and stuff. But there was no changing people's minds. Once they had, you know, facts and all of that, and they had this idea in their head of what this actually was, me telling them what my day was like and how many people I watched die by themselves today, there was no changing their mind. They didn't, not that they didn't care, but they didn't live it. So they don't understand. They can't wrap their head around it. You know, like Belinda said, the young people, you know, my age, I'm 29, you know, people who are healthy that shouldn't, you know, that shouldn't end their lives that soon. You know, there was no changing people's minds about this. And I think that was, again, like I said, a battle within myself that I learned, you know, that my reality is my reality and I should not push that on other people.
Yeah, thank you so much, Gabby, for sharing that. Elise, tell us, what lessons have you learned?
A couple of lessons about myself. I learned that faced with a challenge like that, I was still a team player and still could dig down really deep and pull up some old skills that are still very relevant to take care of and do what I needed to do, and not to let my anxiety make me run the other way. I learned some lessons about other people. I learned about kindness. I learned about kindness to strangers. And I often say this to my own staff: walk a mile in someone else's shoes and try to be kind, because what you see on the outside is not really what they're going through. And as full of anxiety as we were dealing with this, the unknown and people that were quarantining and staying home, they had their own anxiety because they weren't out there seeing it. So they were construing in their head what they thought was really going on. And then there was the ugly side that I really didn't want to learn. And I learned that there are some people that are more self-centered and selfish than I ever imagined. And again, we won't get into politics, but how dare you not wear a mask? If I suffered with COVID, I put my life on the line to help people during COVID, and I watched people die of COVID. Wearing a mask is the most respectful thing that you can do. And if you're not wearing a mask, even if you don't believe in it, it's just total disrespect for humankind and your brothers and sisters. So that was the ugly side.
Strong words there, Elise. So Belinda, tell us, lessons learned.
I think the number one thing that I learned was that none of us, the whole world, we're not immune to tragedy. I mean, when these kind of things happen, everybody it was a pandemic, everyone from around the world was affected by it. And the hospital, everyone, they were just going through so much, and there was nothing we could do about it at the time. We just had to roll with the punches and do the best that we could. And when natural or diseases like this, diseases like this happen, we just have to all come together and do what we have to do. And in a sense, that kind of just makes you realize that you need to, you just need to take things seriously. You need to listen to your bodies. You need to make sure that when you're feeling a symptom, you go ahead and get it checked out. You can't wait. Your body's telling you something. You have to go, and you have to prioritize yourself and your health. And yeah, just be mindful that anything, this world is crazy. Anything at any moment can happen, as we saw this year.
Yeah, thank you for that. Irene, tell us, lessons learned.
And I would say simply, understand the importance of the little things in life. Don't sweat the small stuff. I'm sure people that have lost, loved ones through this pandemic would say the same thing. I would encourage everybody, because it was surprising actually how many people do not have conversations about what they would want for themselves if something were to happen, where they're going to be on a ventilator. And I'm sure certainly Belinda has seen that in the ER. you know, when doctors or nurses are asking questions like regarding, do you want CPR? Do you want intubation? Have you ever had a discussion with your loved ones about what they would want? I've learned that that's not the case for so many people. And it's important, especially for patients with chronic illness, you know, a lot of the elderly, especially that live at home with their families. You know, this is a perfect opportunity to bring up that discussion. It's not an easy discussion, it's a difficult one, but it's important to talk about things if they're to happen. Again, COVID happened. We hope, of course, that it doesn't happen again, or at least certainly not to the extent that it has. But when a family has a discussion and knows what their loved one would want, for example, if they were in respiratory distress, the way that Belinda's described, and you know, just don't know what to do. Do they want to die peacefully and respectfully, or do they feel like they would be okay with intubation, knowing that they're not sure what the outcome would be? Because when you're asking a family to make a decision at that point, and they've never had that talk with their loved ones, it's not easy for them. And sometimes they do things because they think it's right, but again, they've never had the conversation, so they're not sure. And it puts people in a really bad place.
Well, thank you so much, everyone, for sharing those experiences and those lessons learned. And young people, sometimes we feel we are untouchable. Gabby, speak to that for us. What message do you have for young people?
Okay. It's exactly what you just said. You are not untouchable. You know, it can happen to you. It can happen to a loved one. You know, it's like I said, I'm 29, and I was like, oh, you know, it's affecting the elderly. You know, it's, you know, I'm okay. You know, but it's not the case. You know, don't be so narrow-minded. And to touch on Elise too, like, respect. You know, it's a very hard thing for people of my generation for some reason, is respect. You know, not just healthcare workers. You know, of course we were, you know, our healthcare system was, you know, overwhelmed, so, you know, people look at that, but other people who were, you know, nursing homes, and you know, people who were, you know, quarantining inside their homes for months and did not leave, and you know, the people who were alone, who didn't have family or whatever, you know, be respectful. You know, it's a big thing for me. And
Thank you.
Yeah.
Families are worried, anxious because we don't know what's going to happen again in the next few months. We hope it doesn't happen in the next few months, but we can't be so sure or certain about that. So Elise, please, what message do you have for our families?
The message is that I think people should do what alleviates their anxiety. So for example, if somebody was coming to my home, I would say, are you comfortable with me wearing the mask, or are you okay with just keeping distance? Do you want a hug? Do you not want me to touch you? Do you want to sit outside? What makes you feel most comfortable? And I think that the respect of you as a person and the knowledge that you have and the fears that you have are best handled by being open and honest with what you need. So if you say, I need you to back away, or can you pull that mask up over your nose as well? We need to respond, not because of our defenses, but because it makes that person more comfortable. So if I see somebody wearing a mask down here, I say, it would make me more comfortable if you pulled the mask up over your nose. So I'm making it about what your needs are, what my needs are, because I don't want you to become defensive. I want you to say, geez, we're in this together. And if it makes her more comfortable for me to just pull the mask up over my nose instead of wearing it halfway on my face, then I'm going to do that. So I think it's about open communication and honesty to help relieve the anxiety within the family, and really talking about what you need for yourself, not what you should do, I shouldn't go to someone and say, you should really wear that mask over your nose, because that's telling someone else what to do.
Mhm.
I would say it would make me more comfortable if you pick that mask up and put it over your nose. And I think most reasonable people would respond to that. And I, within families, I do it with my own family when they come. Are you comfortable with me giving you a hug today?
Right.
They know I respect it.
So, Belinda, schools are opening up. Parents are returning kids to school. Kids are getting back to school in person, teaching, hybrid, online, some hybrid. And a lot of parents and teachers are afraid. They are worried of this. What message do you have for them?
Oh, of course, the number one thing is be cautious of the spread of germs. I feel like we need to remind our kids, our children, especially young ones, to keep their masks on, but not just say keep your mask on. Explain why they need to keep their masks on. Explain to them when you have your mask on, it prohibits you from touching your face, your nose, your mouth, which are the common entryways from when you're a child. You touch your mouth, you touch your nose, and that's how you usually get sick. And explaining this to kids who might not understand, oh, I can take my mask down, I'm okay, even for 5 minutes or so. I think parents really need to just explain the mechanism of how you get sick from these germs so kids can actually understand and make the connection as to why they have these masks on their faces. Um, Also, of course, washing their hands frequently, just being very cautious about not spreading germs. Coming back in the house when they come home from school, you can't be too cautious. You can have them take their clothes off like we did as healthcare workers,
Mhm.
throw them right in the wash as soon as they come home, let them take a shower as soon as they come home. Because again, you can't be too cautious, you can't be too clean in this time.
Thank you so much for that. So, Irene, one final thought from you to everyone, especially about end of life situations, what we need to know, what we shouldn't be afraid of, what we should prepare for to help our families and maybe everyone around us.
Mhm. Well, again, I mean, I think just to summarize everything, I mean, hope for the best, really, but prepare for the worst. And give ourselves all some kudos, because 6 months ago, New York had the highest rate. And by the end of August, they actually had the lowest rate. So know that we are all doing something really well. And continue to do that. Continue to, live by the protocols that have been put in place. I mean, who honestly thought that 6 months ago we would all just know to get out of the car, put our masks on when we have to enter a store? And
Yeah.
people get used to doing what's expected of them. And children will too. Teachers, I know it's difficult for them all going back to work now and understanding this whole new world that they have. But children especially, they are good with routine, they are good with structure. Like Belinda said, hand washing, hand sanitizing, and just reinforcing that on a daily basis, and it becomes rote. With regards to the patients that I would see on a daily basis, while we are in this point where things have leveled out, and we hope that it stays that way, of course, but again, prepare with those patients with chronic disease, have that conversation with them about what they would want if for any reason, again, they're hospitalized, whether with COVID or actually without. For patients, again, with life-limiting illnesses, like cancer, of course, those are for anybody, actually, not just for anyone that has an illness. It's good for everyone to have that discussion with their loved ones about what they would want. Pick a healthcare proxy, somebody that you feel can speak appropriately to your wishes. And they can only do so if that conversation is had. So I would encourage that firstly. And then secondly, again, I know we understand it's a difficult situation, but just put it out there. If something were to happen, do you want us to put you on a ventilator? Do you want us to try to resuscitate your heart? And it's better to know and say, I've spoken to so many families that don't know. It's much more difficult when they have to make that decision. It is a much easier transition with better closure for everybody involved when I speak to a family who tells me, well, I know I'm doing the right thing for my mom, my dad, my wife, my husband, because we've had that discussion. And again, hope for the best, but again, prepare for the worst.
Wow. Thank you everyone for speaking to all these questions and all these discussions about self-care and COVID and everything around it. And I want to hand over to my co-host if we have people for questions.
Okay, so again, if you have questions for members of our panelists, for those who are joining us on Zoom, you do have the ability to enter at the bottom of your screen. There's a chat bubble. You can ask questions of our panelists. They'll be more than happy to answer it. Once again, I will share my screen and show you Andrew's information in the event that you're looking to ask questions directly to, can you see that screen?
Yeah.
Yep.
With Andrew's information, great. You can reach Andrew directly, and I'm going to pivot and move the screen a little bit up so that you can see Andrew's telephone number. His number is 845-333-7324, or you can send him an email at aoni@garnethealth.org, AONI@garnethealth.org, and you can ask as many questions as you need to here during this Zoom presentation. We also have a live feed of this presentation going out to YouTube, so feel free to connect with Andrew if you have some questions that he can answer. So I will go ahead, and at this point I will check our chat feature to see if we have any questions. Before I do that, I just like to say to the panelists, thank you for telling us about your time with the patients and the whole experience. And what really resonated with me were your self-care tips. I know I'm non-clinical, but listening to those meditation apps were really effective for me during that COVID period. And also I made that personal decision to work out extensively. That was my therapy, workout therapy, listening to meditation, and then also listening to music and watching my favorite TV shows really disconnected me, and I got to see the lives of the TV characters. And that was really good for me during this time, because after a while watching those news reports every single day and hearing the numbers, seeing the different states and countries that were affected, I needed a break from reality. And so looking at a comedy was very helpful for me. Meditating with the family was very helpful for me. So I get it and I understand it. So if we have any questions, I will go ahead and check. Otherwise, Andrew, I think you have a lot of questions coming your way.
Okay, so I'm ready.
On your phone, or they
Yep.
will send you an email. But it looks like for now, with the attendees that we have, I do not see any additional questions at this point.
All right. Maybe we'll wait for 2 more minutes and then wrap it up if there are no questions.
Okay.
So how are you guys feeling?
Ready for my shift.
I like that. Yeah, it's always tough when you have to kind of express your feelings this way. So I just want to make sure that you guys are feeling good. And then if you need any kind of, Andrew, I need to talk. I'm here.
It feels good, Andrew. It feels good to be able to talk about it.
Yes,
You know, in
for
hindsight,
sure.
looking at everything that we went through and now being able to talk about it, as it's kind of, you know, it not in the past, but the bulk of it is in the past. Now looking back at it, it feels good to know that we went through that time period of our lives.
Yeah.
It just makes you just feel so great about especially me, for my profession and what I'm able to do in this field. So it's definitely very humbling, as Elise had mentioned earlier.
Yes, so true.
I'm happy no one cried. I thought I was gonna be
I know.
one to cry.
But you
But I'm happy
almost
no one
did,
did, right?
Gabby. You almost went there. You almost did. Yep. All right, guys, I guess we have no one to ask any questions. Hopefully, I'll get emails and, and phone calls from
Wait,
people.
we do have a question.
Oh, okay.
So let me go ahead. Cheryl would like to say, very grateful to all of you for your service to the community. Thank you so much. And thank you for sharing so openly and revealing your true experience. Beautiful experiences. So as a comment.
Thank you.
Thank you, Cheryl.
Very nice. And let's see if we have any other questions at this point. No, okay. So it looks like it's going all to your email, Andrew, and I'll go ahead while you give your thoughts. I'll go ahead and share your information for everyone again.
All right.
Okay. So you can contact Andrew. It's aani@garnethealth.org. He's available. He'll probably have 1,000 emails with questions. So
I'm ready for that.
we'll have to do this again. So
Yes.
let us know.
Yep.
And
We can help you answer the questions, Andrew, too.
Yeah.
Oh, that would be wonderful, Gabby. Thank you so much for that.
And you can reach him via telephone. His number is 845-333-7324. And it looks like we might have another message. So
Okay.
bear with me one moment. But this is Andrew's contact information. And I will stop my screen share and I will read the comment and or question. So Jennifer would like to say thank you so very much. This session was very needed and appreciated. So thank you so much, Jennifer.
It appears questions are beginning to come in. Do we have 5 more minutes of waiting for people in case somebody is interested in sharing something?
Sure. If one of the attendees would like to share, what we can do is we can turn on your mic and your video, and you can feel free to share if you're looking to share this time. We have a few people on. And again, we have viewers on YouTube as well. So
I'm finally YouTube famous.
we all are.
Yeah.
We all are.
Yep.
So I'm looking at the attendees and we have another comment. So I'll go ahead and utilize the chat button. Dove, thank you all. You are all heroes. Gabby, I'm so proud of you.
Oh.
Oh boy.
Oh.
Hey, Mom.
Oh, that's Mom?
That's Mom.
Oh, that's a proud mom, I know.
Yes.
Mom, we're proud of her too.
Hi, Mom.
Definitely.
That's good. That's good.
For all those who, were interested in watching this video, and what we'll do is we'll play this video on the Community Health channel on YouTube. And so it will be available for rebroadcast. Anyone who's interested in viewing it can do so. Okay, so it looks like that's all on the chat panel there, Andrew. So I'll turn it back to you to close.
All right. I just want to thank everyone, all our panelists and my co-host for spending this time with us to share your experiences with our people in the community. I'm really so grateful and so humbled by your vulnerability to share your experience with us, because when you share these kind of experiences to the world and with the world, you're making yourself vulnerable to them. Thank you for that. And know for a fact that we are always rooting for you at all times. You are indeed our heroes. Keep that in mind. And tell that to everyone you've worked with, that every clinical employee and non-clinical employee who actually work directly with patients with COVID are all our heroes. You are all our heroes. And so thank you for your service, for your sacrifices, for not quitting on us at that time. Thank you so much for that. I just want to thank also the organizational development and staff learning department for allowing me to make use of the services of Dorothy, who has been spending time to plan prepared this with me and worked with me to get this going. And then I thank all the executive team for the approval for this, and everyone who's been a part of this self-care forum. I want to thank you all for your support, and looking forward to the next time we'll have this in about a month from now. So watch out for the next session, for the next panel discussion on something different from this, and hopefully we'll bring people who are able to speak to those experiences at the time. And for now, please have a wonderful night and
Thank you.
good night.
Thanks, guys. Bye, Andrew.
Bye,
Thank you.
everyone.
Take
Bye.
care. Thank you
You
so
too.
much. Have a good one.